When your cat suddenly stops greeting you at the door or sleeps a little longer than usual, do you just assume they're being lazy? We often joke about our cats sleeping all day or giving us the cold shoulder. It feels normal because cats are independent creatures by nature. But beneath that quiet exterior, they might be hiding something serious. Cats are absolute masters of disguising discomfort, and if you misunderstand their silence, which most owners do, you could be missing subtle cries for help, letting a minor ache silently turn into a serious emergency. Let's start with why they hide it and what their face is actually telling you. First, you have to understand the survival instinct. In the wild, cats are mid-level predators. This means they are brilliant hunters, but they are also hunted by larger animals. Showing weakness, illness, or a limp in the wild simply equals not surviving the night. So, their bodies and brains have evolved to mask their suffering completely. 1. The purr paradox. We all think a purring cat is a happy cat, but that is actually one of the biggest myths in pet care. Yes, they purr when they are comfortable on your lap, but cats also purr when they are scared, sick, or in severe pain. Why would they do that? Because a cat's purr vibrates at a specific frequency between 25 and 140 Hz. Science has shown that these exact frequencies actually promote tissue regeneration and bone healing. When your cat is injured or feeling terrible, they are using their purr like an internal physical therapy device to self-medicate. If your cat is hiding under the bed or sitting alone in a dark closet and purring loudly, they are not feeling cozy. They are trying to heal themselves. 2. Their face changes shape. Have you ever noticed your cat staring blankly with their ears slightly pinned back while resting? We often look at our cats, but we rarely read their facial muscles. Researchers at the Université de Montréal discovered something groundbreaking called the feline grimace scale. They proved that you can instantly tell if a cat is in pain just by looking at specific parts of their face. Let's look at the ears first. A healthy, relaxed cat has ears pointing forward and upright. A cat in pain will pull their ears apart, flatten them, and rotate them slightly outward, almost like airplane wings. Next, look at their muzzle. Normally, a cat's muzzle is round and soft, but pain causes those facial muscles to tense up, making the muzzle look flattened, pinched, or strangely tight. Even their whiskers change. Instead of gently curving down by their chin, a pained cat's whiskers will spike straight out or bunch tightly together against their cheeks. They pull their eyes into a tight squint, completely changing their soft expression into a rigid mask. In my time studying feline behavior, I have seen countless owners feel incredibly guilty when they finally realize their cat was hurting. But you simply cannot fix what you do not know. The good news is that you don't even have to guess anymore. New AI technology like the CatsMe and Sylvester apps can actually scan your cat's face using your phone, camera, and detect these subtle muscle shifts with incredible accuracy. But their face is just the beginning of the story. Once you know how to read their expression, you have to watch how they move, because the way they navigate your living room reveals exactly where it hurts. 3. The hesitation jump and the downward stare struggle. Have you noticed your cat staring at the couch or their favorite window perch for a few seconds before finally jumping up? We often write this off as them just calculating the distance, or we simply say they are getting a little older and clumsier. But here is what is actually happening. Dogs will clearly limp and hold a paw up in the air when their leg hurts, making it very obvious to their owners. Cats do not do this. Because of their survival instincts, cats will simply change how they move to hide the weakness. The American Animal Hospital Association released data showing that over 90% of cats over the age of 12 actually have severe osteoarthritis. Yet the vast majority of owners completely miss it because the cat doesn't cry out or drag a leg. Instead, they do the hesitation jump. That 3-second pause before leaping onto the bed isn't them thinking about it. It is them mentally bracing for the physical impact of landing on aching joints. You also have to watch how they use the stairs. Running up the stairs requires muscle strength, which cats can usually handle even if they are sore. But walking down the stairs requires joint shock absorption. If your cat hesitates at the top of the staircase, takes the steps one by one at a strange sideways angle, or kind of bunny hops down instead of walking smoothly, their elbows or shoulders are likely in serious pain. They are desperately trying to avoid putting all their descending weight onto their front legs. 4. The pained meatloaf and the sleep shift. What does your cat's favorite resting position look like lately? Every cat owner knows and loves the classic cat loaf, where they tuck their paws completely under their body and look like a little loaf of baked bread. It is usually a sign of a relaxed, content cat, but there is a very dangerous variation of this called the pained meatloaf, and to the untrained eye, it looks almost exactly the same. Here is how you tell the difference. In a normal, happy loaf, the cat's weight is fully resting on the floor. Their facial muscles are soft, and their head is either either resting comfortably on their paws or held up with relaxed ears. In a pained meatloaf, the cat is actually hovering a fraction of an inch above their tucked paws. They are holding tension in their shoulders and back, unable to put their full body weight down because their chest or abdomen hurts too much to press against the floor. Their back will look slightly more hunched, their head will hang unusually low, and their eyes will be tightly squinted. They look like they are resting, but they are actually locked in a highly tense, uncomfortable brace. You also need to pay close attention to how they sleep at night. Did your cat used to curl up into a tight, perfect little ball, but now they only sleep sprawled out straight on their side? Many owners think their cat just found a new favorite sleeping position, but it is often a major red flag. Conditions like spinal arthritis make it incredibly painful for a cat to bend their back, so they simply stop curling up. It is not a new preference. It is a physical limitation. They are stretching out because it is the only way to relieve the pressure on their spine. When a cat's body physically hurts to bend, move, or jump, it doesn't just change how they sleep or walk. It completely rewrites their daily habits, leading to the one specific behavior that frustrates owners more than absolutely anything else. Gemini said. 5. The bathroom mystery and the soft surface rule. Have you ever walked into your bedroom and found that your perfectly trained cat has peed right in the middle of your bed or on a pile of clean laundry? It is incredibly frustrating. Most owners immediately think their cat is doing it out of spite, maybe because you worked late or changed their food. But cats simply do not feel spite the way humans do. If your cat suddenly stops using the litter box, they are almost certainly trying to tell you they are in serious pain. Think about how a urinary tract infection or painful bladder crystals feel. It hurts terribly to go to the bathroom. When your cat steps into their litter box and feels that intense burning pain, their brain makes a very simple, direct connection. They think, this plastic box hurts me. They don't understand that the pain is actually inside their own body. Because of this, they become absolutely terrified of the litter box itself. Instead, they start looking for the softest, safest, and most comforting place they can find to relieve themselves, hoping it just won't hurt this time. That is exactly why they choose your soft mattress, your worn clothes, or the plush living room rug. They are not mad at you. They are escaping a place of pain and seeking comfort. If you see this, please don't yell at them. They are crying out for your help. 6. The touch reaction and the sudden bald spots. We all know exactly how our cats like to be petted. But what does it mean when a cat who usually loves a good back scratch suddenly hisses, swats, or violently twitches their skin when you gently stroke their spine? There is a highly documented medical event called the wind-up phenomenon. When a cat has untreated continuous pain inside their body, like deep joint pain from arthritis, their spinal cord literally changes how it processes feelings. Their nervous system gets wound up so tightly that a normal, gentle touch starts to feel like burning needles. This is called allodynia. You think you are giving them a sweet, loving pet, but to their highly sensitive, overloaded body, it feels like a painful shock. This is also exactly why you might suddenly notice a strange bald spot on your cat's front leg, hip, or belly. When a specific joint hurts deep inside, a cat doesn't know how to rub or massage it like we do. Instead, they will obsessively lick that one single spot over and over again. They are trying to soothe the internal throbbing ache with their tongue until they literally lick their own fur completely off. It looks like a skin issue, but it is actually a deep bone or nerve issue. But while a bald spot or a bathroom mistake gives you a little time to call the vet and schedule an appointment, there are a few final silent cries that mean you have to stop exactly what you are doing and get help right now, Gemini said. 7. Dietary sifting and the head press. Has your cat ever walked up to their food bowl, taken a bite of dry kibble, and immediately dropped it out of the side of their mouth? Or maybe they chew in a really exaggerated way on just one side of their face. Most owners think their cat is just being a picky eater, or that they suddenly decided they hate their current brand of food. But this is actually a classic sign of severe dental disease. Studies show that over 70% of cats have painful dental issues by the time they are just 3 years old. If they are begging you for soft, wet food, but completely ignoring the crunchy, dry food they used to love, their teeth or gums are likely throbbing in pain. But there is one more sign that is even more urgent. Have you ever seen a cat walk up to a blank wall, a door, or the side of a couch, and just press the top of their head firmly against it without moving? Sometimes they will even look like they are trying to push the wall over with their forehead. You might see a photo of this online and think it looks funny or cute. Do not ignore this. This is not a quirky behavior. In the veterinary world, this is called head pressing, and it is a massive red flag. It means your cat is experiencing extreme neurological pressure, toxicity, or trauma inside their head. If you ever see your cat doing this, it is an absolute medical emergency. Now, if you notice any of the 7 signs we talked about today, you might naturally want to help your cat feel better right away. This leads to the single most dangerous mistake a pet owner can make. You must never, under any circumstances, give your cat a human painkiller like Tylenol or ibuprofen. Humans have specific enzymes in our livers that safely break these medications down. Cats completely lack these enzymes. Even a tiny piece of a human pain pill is highly toxic and often fatal to a cat. We want to do everything we can to protect our pets, but trying to treat them at home with our medicine will only make things much worse. Instead, trust your gut. You know your cat better than anyone else in the world. If they are hiding, hesitating before they jump, missing the litter box, or showing that tight, pinched face we talked about earlier, take a quick photo, run it through an AI tool like CatsMe or Sylvester to check their feline grimace scale, and then call your veterinarian immediately. Show them the photo, explain the subtle changes in their routine, and get them the safe, professional help they actually need. If this video helped you understand your cat a little better, please subscribe to our channel so that our safe, research-backed videos will always be available for your pet's life and care. You can also comment below to share your own experiences or ask questions about your cat's behavior. We are here to help you give them the happiest, healthiest life possible.